Hello, my name is Dr. Dewan S. Raja. Today I will discuss about tardive dyskinesia. We have some questions and we have answers to those questions. So, what is tardive dyskinesia? Tardive dyskinesia is a basal nuclear disorder caused by the adverse effects of chronic treatment with antipsychotic drugs, particularly the first generation antipsychotic drugs. So, this is a disorder of the basal ganglia, we can also call basal nuclei. These are present inside the brain. These are the gray matter masses inside the white matter of the brain, like the caudate nucleus, lentiform nucleus, corpus striatum. They are connected to the substantia nigra and they have multiple functions. Specifically, they help in the formation of platform for the voluntary movements. So, what are the manifestations of tardive dyskinesia? We'll have our patient will have choreoathetosis, that is the abnormal movement, stereotypic movement of the face, tongue, and body, and cogwheel rigidity. These are found in case of basal ganglia or basal nuclei. Same, always interchange these two words, ganglia and nuclei. Better to say basal nuclei because it is in the central nervous system and it will cause the abnormal body movement and also cause cogwheel rigidity. Like choreoathetosis, this is the choreo like dancing movement, athetosis movement like worm, and other stereotypic movement of the face, tongue will stick out, face expression will be different, okay, and there will be abnormal movement of the body, trunk, limbs, and the fingers. There will be cogwheel rigidity, so movement will not be smooth, rather it will be interrupted. So this all happen due to disorder in the basal nuclei and the substantia nigra which releases the dopamine. This type of manifestation is more frequent in young age group, women and individuals with mood disorder. What are the examples of first generation antipsychotic drug which causes tardive dyskinesia in significant number? So these are the chlorpromazine, very old antipsychotic drug, haloperidol, and pimozide. These are a few of the first generation antipsychotic drug. Okay, so this I have taken from the PowerPoint. You have to know some cartoon or schematic presentation. Symptoms may range from mild to severe. Movement in the mouth such as frowning, sticking out tongue, lip smacking, puckering, and pursing. Rapid movement of the body. There is a choreoathetosis, commonly in the arm, leg, and trunk. Face disfigured facial features such as drooping of the mouth and eyes. And there will be rapid blinking of the eyes. Then there may be difficulty in breathing, difficulty in swallowing, and difficulty in speaking. So these are the symptoms of tardive dyskinesia. It may be mild, it may be severe depending on the patient and the doses of the medication, duration of the medication, type of medication. Okay. So what is the etiology or cause of tardive dyskinesia? This is a form of drug-induced denervation hypersensitivity which is caused by chronic dopamine blockade in the basal ganglia. Again, basal ganglia is interchanged with the word basal nuclei. So these are same thing. It is appropriate to say basal nuclei, but always I've seen many books say basal ganglia. Tardive dyskinesia is believed to be caused by the upregulation and increased sensitivity of dopamine receptor in the basal ganglia and damage to striatal cholinergic neurons. So this is the cause of tardive dyskinesia. It is drug-induced denervation hypersensitivity, which is caused by chronic dopamine blockade in the basal ganglia or basal nuclei. What drug causes tardive dyskinesia? Antipsychotic drug, particularly first generation antipsychotic drugs like chlorpromazine, haloperidol, anti-nauseating drug like metoclopramide, prochlorperazine, antidepressant like amoxapine. So this drug may cause tardive dyskinesia. What are the examples of second generation antipsychotic drug? These are the clozapine, olanzapine, risperidone. Advantage, they they may be responsible for less incidence of tardive dyskinesia, and these drugs are also useful in the management of mood disorders. Or mood disorder is managed by this drug, plus they are also antipsychotic drug, and they have less adverse effect like tardive dyskinesia. What is the adverse effect and advantage of clozapine? Adverse effect is agranulocytosis is the adverse effect, but clozapine has less possibility to cause tardive dyskinesia in a psychotic patient treatment, and like other second generation antipsychotic drug, they may be useful in the management of mood disorder like that of the bipolar disorder. Okay, they may be helpful. What is the treatment of tardive dyskinesia? Its treatment is very difficult. Better to go through prophylaxis prevention, use of lowest effective dose for the shortest possible time, and if appropriate, we may treat with second generation of the antipsychotic drug like clozapine, olanzapine, like that. If possible, gradually decrease and withdraw drug to switch to a second generation antipsychotic drug. What is the prognosis of tardive dyskinesia? It is usually irreversible. It is a permanent problem. Choreoathetosis may be decreased in certain situations, rarely, if the first generation antipsychotic drug is discontinued. So that's all about tardive dyskinesia. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. And have a nice day. Bye now.